vaccine found by Russian government. This vaccine was named Sputnik 5. Scientists uneasy as Russia approves first coronavirus vaccine. Russia on Tuesday became the first country to approve a coronavirus vaccine, a move that was met with an international skepticism and uneasy because the shots have only been studied in dozens of people. President Vladimir Putin announced the health ministry's approval and said one of his two adult daughters already was injected with the new coronavirus vaccine. He said the vaccine underwent the necessary tests and was shown to provide lasting immunity to the coronavirus. Although Russian authorities have offered no proof to back up claims of safety or effectiveness, I know it has proven efficient and forms a stable immunity, Putin said. We must be grateful to those who made the first step very important for our country and the entire world. However, scientists in Russia and other countries sounded an alarm, saying that rushing to offer the vaccine before the final stage testing could backfire. What's called a phase 3 trial, which involves 10,000 of people and can take months, is the only way to prove if an experimental vaccine is safe and it really works. By comparison, vaccines entering final stage testing in the US require studies of 30,000 people each. Two vaccine candidates already have begun those huge studies, with three more set to underway by fall. Fast tracked approval will not make Russia the leader in the race. It will just expose consumers of the vaccine to unnecessary danger, and Russia's Association of Clinical Trials Organizations in urging government officials to postpone approving the vaccine without completed advanced trials. While Russian officials have said large scale production of the vaccine wasn't scheduled until September, Deputy Prime Minister Tatiana Golikova said vaccination of doctors could start as early as this month. Officials say they will be closely monitored after the injections. Mass vaccination may begin as early as October. We expect 10,000 of volunteers to be vaccinated within the next month. Kirill Dmitriev, chief executive of Russian Director Investment Fund that bankrolled the vaccine, told reporters. The vaccine was developed by the Gamaleya Institute in Moscow with the assistance from Russia's defense. Uses a different virus, the common cold causing adenovirus, that has been modified to carry genes for the spike protein that codes the coronavirus, as a way to prime the body to recognize its real COVID 19 infection comes along. That similar technology as vaccines being developed by China's CanSino Biologics and Britain's Oxford University and AstraZeneca. But unlike those companies, Russian scientists haven't published any scientific information about how the vaccines performed in animal tests or in early human studies. Dmitriev said even as Russian doctors and teachers start getting vaccinated, advanced trials are set to start that will involve several thousand people and span several countries, including the United Arab Emirates, Saudi Arabia, the Philippines, and possibly Brazil. The Associated Press couldn't find documentation in the Russian health ministry's record indicating that the permission to start the advanced trial was granted. The ministry has not responded to a request for a comment. Putin said one of his daughters who has received 2 doses had minor side effects such as slight fever and is now feeling well and has a high number of antibodies. It wasn't clear if she was one of the study volunteers. The health ministry said in a statement Tuesday that the vaccine is expected to provide immunity from the coronavirus for up to 2 years, citing its experience with vaccines made with similar technology. However, scientists around the world have been cautioning that even if vaccine candidates are proven to work, it will take even more time to tell how long the protection will last. The collateral damage from release of any vaccine that was less than safe and effective would exacerbate our current problems insurmountably. Imperial College London immunology professor Danny Altman said in a statement Tuesday. The World Health Organization said all vaccine candidates should go through full stages of testing before being rolled out. Experts have warned that vaccines are not properly tested can cause harm in many ways, from harming health to creating a false sense of security or undetermining trust in vaccinations. Becoming the country in the world to approve a vaccine was a matter of national prestige for the Kremlin as it tries to assert the image of Russia as a global power. Putin repeatedly praised Russia's effective response to the outbreak in televised addresses to the option, while some of Moscow's top officials, including country's prime minister and Putin's own spokesperson, became infected. And the US, Britain, and Canada last month accused Russia of using hackers to steal vaccine research from Western labs. Russia has denied involvement. Russia has so far registered 8,97,599 coronavirus cases, including 15,131 deaths. The Gamaleya Institute's director Alexander Ginsberg raised eyebrows in May when he said that he and other researchers tried the vaccine on themselves before the start on human studies. Those trials started June 17 with 76 volunteers. Half were injected with a vaccine in liquid form and the other half with a vaccine that came as soluble powder. Some in the first group were recruited from the military, which raised concerns that the servicemen may have been pressured to participate. The test was declared completed earlier this month. It's too early stage to truly assess whether it's going to be effective, whether it's going to work or not. Dr. Michael, head senior research fellow in global health at the University of Southampton. It's not Russia's first controversial vaccine. Putin has bragged that Russian scientists delivered an Ebola vaccine that proved to be the most effective in the world and made real contribution to fight the Ebola virus in Africa. However, there is little evidence either of the two Ebola vaccines have approved in Russia was widely used in Africa. As of 2019, both of the vaccines were listed by WHO as candidate vaccines. So guys, that's all in today's video. And it will be good if the Russia completes its third trial successfully before launching it in other countries and in its own country as mass vaccination, because most of the people will believe in that. So guys, that's all in today's video. Thank you. If you like the video, like, share and subscribe to my channel. Meet you all in the next video. Thank you.